Morning, everyone. Okay, we'll get started. And I'm here with Professor Sutton and also with Sue Anderson, who is a tutor at Langwarrin Park Primary School, and we'll talk about our tutor program very, very shortly. So firstly, I'll give you the COVID stats for today. There were 1,377 new cases yesterday. All of those were locally acquired. This brings us to a total of 12,711 active cases. We regret to report that 4 people have lost their lives with COVID-19. A woman in her 70s from Hume, a woman in her 60s from Hume, a man in his 60s from Manningham, and a man in his 80s from Moreland. This will be an extremely difficult time for their family and friends, and we extend our deepest condolences to all of their loved ones. 498 people are currently in hospital with COVID-19, 96 are in ICU and 59 are on a ventilator. Of the new cases we're reporting today, 45% are aged between 10 and 29. 67,789 tests were processed yesterday. That's a record for a Sunday. So my thanks to all Victorians who went out and got tested. Over the weekend, we had around 8,000 VCE students getting tested ahead of the GAT tomorrow in hotspot postcodes. And from this GAT testing, we've identified 33 positive cases amongst students. We may not have found these cases otherwise, so that goes a long way to help us hold the GAT as safely as possible tomorrow. The Department of Education is contacting these students and letting them know that they cannot sit the GAT, and we'll make arrangements for how they can sit their exams at a later stage if indeed they're unable to sit any of their exams. 30,985 vaccines were administered at our state hubs yesterday, and many thousands more were administered in GPs and pharmacies. 52.5% of the over 16 population has now received a second dose of COVID-19 vaccine, and 82.8% have now received a first dose. Interestingly, if we include the total eligible population of people 12 years and over, the first dose rate is very close behind at 81.1%. And this really does reflect the rapid and enthusiastic uptake of vaccines in the newly eligible 12 to 15-year-old cohort, with 160,000 young people coming forward for their first dose in the past few weeks. In terms of first dose appointments available in state clinics over the next 7 days, we have more than 4,200 Pfizer appointments, more than 8,500 AstraZeneca appointments, and more than 23,000 Moderna first dose appointments. And there are many tens of thousands more appointments of all 3 vaccines available through our GPs and our pharmacies. More Pfizer appointments will be added progressively, but a reminder, overall, there are 100,000 Moderna available right now. Today, I'm also pleased to announce a really positive vaccination initiative. The Victorian Aboriginal Community Controlled Health Organisation, community leaders and other health services are partnering to bring dedicated vaccination vans into our Aboriginal and Torres Strait Islander communities. 3 of Victoria's Smile Squad dental vans will be repurposed as vaccination vans, with the first heading to Shepparton today. Shepparton has the largest Aboriginal population in Victoria outside of Melbourne and is currently in lockdown where it is battling an outbreak. Vaccine uptake in Victoria's First Nations communities is high compared to other states and territories, but it is still lower than the broader Victorian population, with 65% having received a first dose. We do know that Aboriginal and Torres Strait Islander people are at a higher risk of COVID-19 due to a number of factors, including pre-existing medical conditions and large households. So this is a really important initiative which will bring the vaccine directly to some of our most at-risk communities. So that's the COVID update. If I can take you now to some education matters. This today is obviously the first day of term 4, and progressively through October, students will return to face-to-face learning. And I'm excited about that. I can't wait to see kids back in front of their teachers and with their peers I know my kids are excited, and this will happen as per the roadmap, both in regional Victoria and in metropolitan Melbourne over the course of the weeks through October. I especially want to send a big good luck to all our final years students. As I said, tomorrow the GAT will be held, and this is a most significant initiative. It's the most significant test. This allows us to moderate students' outcomes across all of their exams. VCE oral and performance exams also start this week. So to the final year students, you have made it through the most challenging final years in the midst of a global pandemic. You have shown incredible resilience and grit, and we are all incredibly proud of you. So good luck for the remaining weeks of your time in secondary school, in VCE, VCAL, and best wishes as you go through these last few weeks into what your future may hold. But I'm also proud of all of our students and all of our teachers and staff. I'm speaking to many teachers. This has probably been the hardest 2 years in their careers. They have been outstanding through 2020 and through 2021. And to our teachers, our staff, our students and our families who have supported our kids at home, you've done a wonderful job, and we're almost at the end of it. So for the rest of our students, prep to Year 11, over the next few weeks, it'll be time to catch up face-to-face with your teachers, with your friends, and get stuck into your learning through Term 4. The focus for all our schools, just like it was in Term 4 last year when students returned after a period of remote learning, the same is the case this year. The focus will be on students' mental health and wellbeing and on their learning, not only for Term 4, but preparing them for 2022. In response to the pandemic and these long periods of remote learning, I've said a number of times, the most important and effective initiative this year in our schools was the Tutor Learning Initiative. This year we've had more than 6,400 tutors employed in government and low-fee non-government schools right across Victoria. Retired teachers, teachers on leave, young pre-service teachers, experienced teachers moving into the tutor program such as Sue that we'll be hearing from in a moment. And all of them answered the call. Our existing workforce, plus the thousands of retired people on leave coming back into our schools to help our kids, making sure every single student received the extra support that they need. And it's paying profound dividends. We released the NAPLAN data earlier in the year, and Victoria is leading the nation in NAPLAN results. Extraordinary, given the circumstances of the last 20 months or so. There was an evaluation conducted, independent evaluation by Deloitte, and it showed that the Tutor Learning Initiative improved attendance, achievement and engagement. It has worked. And given the impact, the continued impact of the pandemic through 2021, we need that support next year. And that's why I'm delighted to announce that a further $230 million will be delivered to continue the tutor program for the whole of 2022. Each individual school will receive the same allocation as they received this year, except for our very small schools. Their allocation will actually go up from $15,000 to $25,000 as a minimum allocation, enabling our very small schools to provide more hours, more staff to deliver the tutor program. So that's the tutor announcement. Finally, from me, October is Mental Health Awareness Month, and it's an opportunity for all of us to check in on ourselves, on our families and our friends, and ensure that people are accessing support if they need it. And there is support available. We've invested more than $247 million in directly related COVID mental health initiatives, including more than 28,000 for school-based initiatives to support kids' mental health. The first 8 pop-up mental health services are now open around the state. Now, this is an announcement I made 2.5 weeks ago. 8 of these pop-up services are already open, and a further 12 will come in over the next few weeks. So I encourage anyone who needs that support to make an appointment to see a mental health practitioner for free. Term 4 also marks the completion of our rollout of the Mental Health Practitioners in School program. So every single government secondary school and every single specialist school now has support for a dedicated mental health practitioner delivering tailored support to students who need it most. This is a year ahead of schedule, and all of those mental health practitioners will work with the existing wellbeing teams in each of our schools to provide what can be a lifeline for our students. So I again thank all of our mental health staff, whether they're working in schools or in the broader community, for the incredible work that you are doing. And I'll have more to say about what more we will be doing in regards to mental health in schools over the coming weeks and months. So that's enough from me. I'm now going to hand over to Sue Anderson, who is a very experienced teacher and has been running the Tutor program at Langwarrin Park Primary School this year. And I thought it would be great for you to hear directly about what impact the Tutor program is having on the ground with our kids. Over to you, Sue.
Thank you. I've worked in the classroom as a classroom teacher for 30 years, the last 30 years. 15 of those years I've either been a level leader or a level coordinator working with children. So when asked to take on the Tutor initiative, it was exciting. It's something that I'm passionate about, and the impact that we've made on the children's learning has been incredible. The TLI was initially created in response to the impact that we had due to the COVID lockdown on the children who struggled during this time, either academically or socially, emotionally, and it helped them in a need to give them extra support that they required just to get back academically. These children were tracking with little growth and no growth during that period, and they needed the support from the Tutor Learning Initiative at school on the ground to get them back. And the impact's been incredible. We've had such wonderful results from our children. These were the children who didn't want to come to school. Suddenly their parents are saying yes, they want to come, they're excited about coming to school, they're achieving, they're kicking goals. Even their excitement when we walk into the classroom, they're jumping up out of their seats to come and work with us. We've had some children make growth of 12 months since term 1 this year. Some have actually made 18 months growth, according to our data, and they don't need the program anymore. And I think that's the biggest indication of how successful the Tutor Learning Initiative has been, is that these are children who required it, have had that extra support on the ground from the tutors, and are now thriving, don't need the program anymore, and we're bringing more children in. We work with the kids, just as a bit of information, 3 times a week for 45 minutes each session, and any extra work that they need beyond that, we're also available online with the kids. We've worked remotely online with the children during the lockdown, and then face-to-face when we've come back to school. The biggest impact has been in the wellbeing and the self-esteem of these young kids who didn't see themselves as learners and had become disengaged and are now thriving. So the announcement that you made for next year is incredible. Our kids are going to be so much better off for having this funding, and it's what we needed, and we've answered the call. So thank you.
Thanks, Sue, and great to hear of that initiative. Absolutely wonderful. So just an update on the really the geography of cases currently across Victoria with COVID. Western Suburbs yesterday saw 352 new cases, which is about 26% of all new cases. They're primarily in Brimbank, Melton, Wyndham, Moonee Valley and Maribyrnong. The northern suburbs, 42% of new cases, or 582, primarily in Hume, 304 cases there, also in Whittlesea, Moreland and Darebin. The southeastern suburbs, has really been a growth area in terms of cases in the last few days, and each day there's a higher and higher proportion that are coming out of the southeast. There were 293 new cases yesterday. That's 21% of today's numbers. Primarily Casey, Greater Dandenong, Cardinia, Monash and Port Phillip. And the eastern suburbs, smaller number of cases, but again, a growth in the last few days. 72 new cases, with 20 in Maroondah and 18 in Manningham. In regional Victoria, there were 73 new cases yesterday. That brings us to a total of 483 active cases outside of Melbourne. To cover off some of the larger clusters, 13 new cases in Latrobe, mostly Morwell and Traralgon. 12 new cases in Mitchell Shire, primarily known close contacts and with links to Melbourne. 11 new cases in Shepparton for a total of 53 active cases. 8 new cases in Geelong, again mostly known close contacts, but with one unlinked still under investigation. And really, the main thing I'd like to emphasise is that vaccination is making a difference here. We have seen some stabilisation in numbers in Hume and in Wyndham. That really is a reflection of the huge increase in vaccination uptake in those local government areas in the last couple of weeks, as they've gone to the state average and beyond in some of those postcodes. The difference of vaccination is really going to be our pathway out of here. And with the Moderna vaccine being available through our pop-ups and through pharmacies, this is a unique opportunity for everyone who's eligible, 12 to 59 years of age, for the Moderna vaccine to take advantage of those additional doses. There have been more than 56,000 Victorians who've already had their first dose of Moderna, either at a pharmacy or a pop-up. There are another 100,000 doses ready to go. So please take advantage of those appointments and bend that curve in all of those other growth areas. So the southeast of Melbourne is a growth area because there have been lower vaccination levels of coverage there. But again, the lessons out of the northern suburbs and the west is that we can start to bend the curve and drive numbers down again as we get that higher vaccination coverage. So please pick up one of those 100,000 doses. As we've heard from our ICU nurses in recent days, people in ICU are not doubly vaxxed. If you can get doubly vaxxed in coming days or weeks, there is every chance that you will not be one of those statistics with severe disease in hospital, in ICU. And for our authorised workers who are now needing a first dose by the 15th of October with the mandates coming in, this Moderna Blitz is a fantastic opportunity. All of our vaccines that are registered in Australia are fantastic vaccines for protection against dying, against severe illness, against going to ICU. Moderna is probably a nose in front in terms of the length of protection that immunity provides. So it is as good as any vaccine available in Victoria at the moment. So for those aged 12 to 59, please step up and get that Moderna dose. Happy to hand back to you, Deputy Premier.
Thanks, Brett. Happy to answer any questions.
Do you know what percentage of Year 12s are vaccinated and what the risk poses with things like the gap in the coming weeks?
Look, the uptake, the VCE Blitz for both students and staff was fantastic. I don't have exact numbers in terms of VCE students who are vaccinated. What we do know is that in the tens of thousands, young people rushed to get vaccinated, as did teachers and staff, exam supervisors prior to the start of exams. All of these things, all of these mitigating factors make it as safe as we possibly can. Nothing we do in this space is risk-free. Identifying the hotspot postcodes and ensuring Year 12 students who are undertaking the GAT go and get tested is an important thing to do, and we picked up those 33 students who tested positive. But we've got the roadmap. We've got we are opening up the need to have students undertake the GAT, the need to have final year students be able to conduct their exams so we can get their results prior to Christmas. All of these things we need to deliver for our young people and make this year a year of meaning for our Year 12 students. So the VCE vaccination blitz, the testing of students prior to the GAT, all of these things significantly reduce risk factors for students, final year students, as they enter their final weeks of schooling.
Those 33 students, what will happen with their GAT? Will they not have to sit it at all? Will they get special dispensation?
Yeah, so they won't sit there. They won't sit the GAT, and this happens every year, Simon. Every year you have students who are unwell and cannot sit a GAT or cannot sit an exam. So for those students who are unable to sit a GAT, if they're then unable to sit any of their exams, they get what is known as a derived examination score. So they get a derived score with the VCAA working with the school and the teachers in regards to that student and that subject area. So this is well trodden. Schools are perfectly aware of this. It provides a fair score for students, but for those 33, they won't sit the GAT. And they may or may not sit an exam. It depends when their exams start for that student.
Testing for all VCE kids ahead of the GAT tomorrow isn't compulsory though. So how will what's the requirement on schools and teachers to be checking as kids are coming through the door whether they've got a negative result? How are we policing that?
We've made it clear to students in those hotspot areas that they're required to go and get a test. And then attest to that result. So we're putting as strong a fence as we can around this. As I said, nothing we do in this space is risk-free, but rolling out 51,000 air purifiers, requiring all staff to be vaccinated, making sure that we've got mitigations already in place in schools, whether it's staggered pick-up and drop-off times in larger schools, separating students in larger schools. All of those mitigating factors mean that we can keep the risk as low as possible.
When are the air purifiers going to the classrooms?
So they're being rolled out from this week, and it'll be rolled out progressively over the weeks and months of Term 4. So we've already got the first few thousand delivered by air freight. They'll be rolled out in schools this week, and we're focusing, firstly, as you would expect, and based on public health advice, on the 4 hotspot LGAs, and particularly the P to 12 schools and specialist school settings, and we'll be progressively rolling them out to schools right across Victoria.
Do you think all schools, all classrooms will have one before the end of Term 4?
So it will go, the air purifiers, and this will be based off our CO2 testing, the detailed assessment. We're looking at something like 20,000 different school rooms, working out where is it best to place the air purifiers. So obviously the number will be determined by the types of rooms in a school, the number of students, and we'll progressively roll them out over the next weeks and months. But 51,000, this is unprecedented, not happening anywhere else in the country. And based on public health advice, this will make a difference in our schools.
Once those kids are back in the classroom on a much larger scale, how do we treat outbreaks and positive cases? Will it be entire schools will be closed if, say, a grade 2's testing positive, or how far do we spread that?
Well, we're working, Department of Education and Training is working really closely with the public health team within the department to reduce the time and reduce the number of students. So, for example, if there is an outbreak in a school, there will be the need to immediately close and clean a school. But in the past, it's been for a 14-day period. All students are doing remote learning. We're working with Department of Health to ensure that we can keep the number of students impacted and the time as short as possible.
So just to be clear on Steph's question, has the isolation protocol changed for schools now going into Term 4?
Yeah, I might get Professor Sutton to go to this question as well. But we are moving to a different environment where we are opening up. and that will mean that there will be some cases, but in regards to schools, as I said, it's about reducing the time, both for students and for the days that a school is closed. Thanks, Brett.
Thanks, Deputy Premier. Yeah, Simon, the protocol is changing. It's being fine-tuned. We'll continue to fine-tune it as we operationalise it, but essentially there will be a stratification of risk for those contacts. The class will be the most at-risk contacts, obviously, but other classes won't necessarily need to quarantine at home. We certainly won't have the entire school quarantining for a full 14-day period. There'll be assessments based on vaccination status, noting that kids 12 and above may be partially or fully vaccinated, whether they're wearing masks and whether they've been in very short-term or longer-term face-to-face contact with a positive case. So all of those elements will inform a matrix in terms of advice on who needs to quarantine, but that will minimise the disruption for kids, and it will be a really positive development, I think, in terms of making sure that the learning is disrupted to the least possible degree for all of those kids and teachers.
So is that in from today?
Yeah, that'll be in force from now. For the GAT students, there's specific consideration that we're working with DET on. It's not really a classroom style setup in the same way that a school would operate, but it'll be in place from now on.
But they are doing the GAP in halls and spreading out to classrooms.
Indeed.
So
Indeed, and we will still make that same risk stratification and work on on the basis of all of those elements I talked about.
And just on isolation protocols. So we've seen the department moved on supermarkets over the weekend. Schools, obviously, you're telling us about now. What industries and settings are next in terms of changes for isolation protocols?
Look, I think it's worthwhile to have a cross-industry workplace setting that takes account of vaccination status, especially as we've got a much more highly vaccinated population. So the next phase, if you like, will apply very broadly across workplaces, but we want to obviously ensure that there's appropriate stakeholder engagement, how it can be managed, what are the mitigations that some of those industries already have in place that will inform how we manage those workplaces.
If a student or a teacher is fully vaccinated, will they still be required to quarantine for 2 weeks? If they come into contact with if they're a close contact?
Yeah, look, it really will depend on those elements I've spoken about, whether a mask is worn, whether there's extended face-to-face contact and whether or not they're partially or fully vaccinated. But it's not a single element that determines those requirements.
I'm looking at postal workers when it comes to changing isolation requirements. We've seen a huge backlog for Australia Post. Obviously, people can do nothing but online shop at the moment. Are you looking at them as a similar level of essential to what you've looked at supermarket workers? I'm
not sure where it is in the ranking in terms of working through, but absolutely understanding that there's disruptions to some of those essential workplaces will absolutely prioritise according to those discussions that we have with the stakeholder groups.
How quickly do you think that can take effect, though? Obviously, we've moved on supermarkets. Is there a reason why, for example, Australia Post workers, given it's a similar level of essential service, couldn't fit under the same priority as supermarkets?
They're absolutely a priority. They're not always the same kind of setup in terms of how workforces cohort, how many people are potentially affected, but very happy to resolve that, and I don't think it'll take long for many of those other essential industries to land.
On the staggered start to school, some parents are saying it's quite inconvenient to drop offs on separate days. I just wondered if you could talk us through the health advice on how that measure is aiming to prevent outbreaks in schools, and how you hope, if a Monday class get it, then the Tuesday can keep going potentially.
Look, there's no question that it's disruptive to my family, as for many families who've got kids across year groups. The reality is, the greater the time that any child or any year group spends in school, the greater the risk is of transmission within that year group and across year groups as they interact. So the staggered return is to reduce that cumulative volume of kids who are coming together and potentially transmitting. It does also allow an opportunity for that very focused and stepwise introduction of all of those mitigations that the Deputy Premier spoke of. So the application of those HEPA filters, the assessments, the CO2 monitoring that allows for all of those modifications that might need to take place in classrooms as you bring back kids in increments. You can absolutely focus on those safest classrooms, the classrooms that can be, for example, very easily modified with natural ventilation, and then those that can have the HEPA filters prioritised. So it does allow for a staged and progressive introduction that means that kids can be protected in the best way possible.
Just on hospital funding, I had
a recommendation that younger children at primary school wear masks. How feasible do you think that's going to be to see those younger year levels and children be wearing masks inside the classroom?
Look, it won't be absolutely straightforward for every single child. The evidence, however, from international examples, especially out of the US and California as a case in point, is that kids get used to different ways of working very readily. They are very adaptable. They've had to adapt to 20 months of disruption, and not every kid does it in the same way, but the lessons internationally are kids just make it part of their day and they do it very routinely, and they can do it very quickly. None of it's perfect. A cloth mask is not an N95 mask, but it all provides another level of protection. And for those kids who are too young to be vaccinated in Australia at the moment, that's a really important intervention, and it does make a difference. And the examples again from the US with a 3.5-fold reduction in outbreaks for kids who are wearing masks across the board is a really powerful impact.
On hospital funding, I had a question for the Deputy Premier. I was wondering what you made of Scott Morrison describing the call for 50-50 hospital funding as shakedown politics, and is there any prospect 50-50 funding will be extended?
I honestly haven't seen that quote. I would have thought that for all Victorians and all Australians, 50-50 funding sounds about right and sounds about fair. And given that both federal government and state and territory governments have responsibility for our health system and our hospitals, that would be something that should happen, has happened in the past. It's sort of over a period of time got worse and worse in terms of that split, and more pressure on states and territories to deliver public health. But I honestly haven't seen that quote.
Has the federal government given any indication that it might continue the 50-50 funding?
I'll get the Minister for Health to come back to you specifically, because I'm not aware of what engagement has been conducted between our Department of Health and the Federal Department of Health and between ministers. So rather than talk off the cuff, I'll follow that up for you.
Are we still looking at rapid antigen testing as part of the return to school process?
Yeah, as I mentioned last time, I stood up in one of these conferences in anticipation of TGA approval, which has now come. We have been conducting a small trial to look at how feasible, how practical this is, particularly for younger kids. So working with children and their families, working out what's the best way to possibly deliver rapid antigen testing. Does it work if we do it at the home 2, 3, 4 times a week? So that trial is happening, and I'll have more to say once that trial's concluded.
How extensive is that at the moment? And I'm guessing we're not going to be looking to be doing it before November 1st, though, given that's when the TGA approval comes in.
Well, that's right. We're subject to the timelines of the TGA. So this is a small trial, and you only need to do a small trial in terms of getting a sense of how this will work for families and schools. I'll have more to say once we conclude the trial.
Minister, late last month, after the roadmap was announced, Minister Foley was asked about a New South Wales-style social bubble for kids. He said the government would consider any good idea. I just wanted to get your thoughts on that prospect and where we're at with that. Is that something we'll look to bring?
Yeah, sure. And just echo Martin's comments in that, we are always open for good ideas and what we can do next to support to support people as we transition to opening up at 70 and then at 80% as per the national plan. I don't have any further announcements in this space, but it's something that we're looking at.
Ask some questions to Professor Sutton. Professor Sutton, are we still on track to the roadmap dates that were set when the roadmap was revealed? So October 26 for double dose for 70% and November 5 for 80, or have those dates come in at all?
They're more or less at that kind of range. It's all subject to how people step up over coming days in terms of the vaccination coverage, but you know, 12 to 15-year-olds, record numbers. It is literally a vertical line looking at the vaccination coverage for 12 to 15-year-olds. They're coming in droves to get vaccinated. That means that they are not far behind in terms of having our double-dosed 80% coverage for 16 and above, followed by the same kind of coverage for 12 and above, you know, within a couple of days. For other age groups, 16 to 19-year-olds, the same, really strong stepping up. But we do have additional capacity to deliver more doses. I would love to see days of 100,000 plus vaccinations in Victoria. We're doing 30, 40 and above thousand through our state hubs, but there is capacity, especially in pharmacies and primary care. GPs are absolutely core to delivering vaccines as well in Victoria, and so we can do better, and we should do better, but it involves every Victorian who's not yet fully vaccinated coming forward to get their vaccine. And with the reduced interval for Pfizer down to 3 weeks, there is an opportunity for people who've had that later appointment to redo their appointment and get fully vaccinated now. That makes a difference.
Should we be looking at the 12 to 16 age group and counting them towards our roadmap targets?
No, I don't think so. We've got we've got roadmap targets that have been set before we had absolute assurance of the 12 to 15-year-old supply and coverage. We know what we can do with that 80% double dose for 16 and above. I am assuming that our 12 to 15-year-olds will have a very similar coverage by the time that we get to that. So I don't think it makes a material difference in terms of our roadmap.
And what do you make of, I know there's been a lot of talk in the papers on Talkback Radio that Melbourne is now apparently the most locked-down city in the world in terms of days that we've been in lockdown. What do you make of that personally?
I mean, it's been an awful crisis for the world, for Melbourne, more than any other place in Australia. We have to face the crisis that's in front of us. Through last year, it was an awful sacrifice, but what a triumph ultimately to have driven cases back down to nothing, to give us some of those freedoms through late last year and through much of the early part of this year. We have unfortunately faced multiple incursions into Victoria that we have to deal with on the basis of what we're faced with and what it would mean with the vaccination coverage that we had. You know, it's a reality that we are lagging amongst OECD countries for the vaccination rollout. That is the vulnerability that means that you have to have a lockdown to manage, you know, potentially catastrophic numbers and catastrophic numbers of deaths. So, you know, we are effectively left with no choice until we've got that higher vaccination coverage. But we should focus on where we're headed to now. We've got an extra close to 1% vaccinated every single day in terms of first and second doses. So we are well on the way to those roadmap thresholds. That means that we can enjoy so many of the things that we've had to sacrifice over many, many months.
Just on the growing transmission in the southeastern suburbs, the federal government should be releasing fresh vaccination data today, but I think you mentioned that they were lagging behind. Would you consider rolling out a vaccine blitz similar to the one seen in the northwestern suburbs?
Well, it's effectively happened. So there's been a Moderna pop-ups in the southeast. There's been a lot of engagement and announcements on the vaccination availability in the southeast. So yeah, the blitz is everywhere. We absolutely call on those in the southeast to step up and get their protection as for everyone else, because there is a vulnerability while you've got that lower level of vaccination coverage wherever you are in Australia.
How many cases do you think the curfew is stopping at the moment?
Oh, for any single intervention, you can't tease it out. With stay-at-home directions, that's the key. We're telling people to stay at home. We know that compliance is never perfect for any one intervention, but the curfew helps on that regard. I would hate to think how many people might be moving into other households should it not be in place. We know that there's a reduction in traffic in the hours that the curfew is in place, but how to quantify it exactly, it's very hard to say.
How long do you think we'll be stuck with it?
Well, as the roadmap indicates, it's not there forever, and there are thresholds for the roadmap where the curfew will cease to be in place as well.
Do you think it could come off early?
That's by the end of the month.
Do you think it could come off early, by any chance?
Oh, happy, as we do for all of the public health directions, happy to consider it right through. But, you know, we saw a genuine awful increase in case numbers after the grand final. We know that that was related to people moving across households, and it spread into regional Victorian households, new households across regional Victoria and across the east and southeast of metropolitan Melbourne, as well as picking up numbers across Metro Melbourne more generally, that the curfew probably played a role in minimising some of that. But I can't stand here and say it's okay to visit households now because this is all frustrating and we are so fatigued by it. We know what we still have to do, and seeing days of 1,500 cases is still tragic. And healthcare workers are horrified to see those numbers because they know that that represents 10 or 20 people dying 2 or 3 weeks down the track. And so every intervention that can turn those numbers around, that can hold them in place, is really critical.
Do we have evidence that at this stage the curfew is stopping transmission? You mentioned there about the AFL grand final gatherings. People were breaking the rules anyway by gathering in homes. It's not as if the curfew had any impact on that. No,
the curfew may well have had an impact on that. I hate to think, as I've just said, how it might have been if there was no oversight of all movements after curfew hours were in place. There was still significant movement across households. The message is really clear. I can't but give the evidence-based recommendations that transmission within households will lead to a spike in numbers. That's what we saw, and we're still struggling with that. We've seen some stabilisation over the last few days, but if that's our new set point, 1,000+ cases per day, that represents a lot more people in hospital every day, tens of people in hospital every day in addition, and more people dying. Yep. And so we have to do everything.
Just on the AFL, just to be clear, are you saying that the curfew could have, like case numbers could have been higher without the curfew? And also, in what feels a million years ago, the Department of Health released a transmission chain map when we had the 3 removalists from Sydney, just explaining how the transmission had happened. And I was wondering if you would do the same thing for the AFL transmission?
So it's not quite the same. When we had the transmission from the removalists, we were tracking each and every case. We've got a lot of unlinked cases now, as does New South Wales, because of the sheer case numbers. People can't recall where they might have picked it up, and because there are so many exposure sites, so many potential positive cases that they might come into contact with, you can't make those definitive links. But yes, absolutely, I think the curfew could have made a difference. It's pretty clear, and again, the Burnett did some mathematical analysis on the introduction of the curfew with some other measures in Greater Sydney that showed a bending of the curve, a literal bending of the curve that made a difference of thousands of cases. And so I accept that as some evidence for the curfew being in support of those other stay-at-home directions. I expect that that would apply equally in Victoria, as it looks like it did in those at-risk suburbs in Sydney.
When do you anticipate, just on comparisons with Sydney, now that we're 50% double-dosed, when do you anticipate we'll start seeing case numbers come down like they did?
Look, I think it's potentially already happening. So as I said with Hume, early days may not be a trend yet, but it is showing some stabilisation in numbers. but it is patchy, and we can expect growth in those postcodes, those local government areas where vaccination coverage isn't as high. Sydney absolutely turned it around with that kind of 50% vaccination coverage and the high 80 first dose coverage. We are getting to those similar levels, but it has been lower in the places where transmission's been highest, in metropolitan Melbourne in particular. And so we need to go above and beyond that 50% and continue to crack on, especially in Hume, Wyndham, Whittlesea, Darebin, and then, Cardinia, Casey in the southeast, because they are at a relatively lower level. They are moving up, but they remain vulnerable to that higher transmission rate.
We've been told that contact tracing will change a little bit, and it already has. The interviews are shorter. There's more of a focus on vulnerable people. I just wondered, is there thought to getting rid of Tier 3 or the lower tier exposure sites, and how will that contact tracing look as we go into the 70 and 80% double dose vaccination?
Yeah, certainly we have to focus our efforts on where we'll get most bang for buck, the greatest efficiency and effectiveness of contact tracing. We're absolutely contacting every case. Their household and close contacts are being quarantined appropriately and in a timely way. We're still doing really well on those metrics. But Tier 2 sites, there are so many of them. Whether or not we capture that information, people can't go through 100 pages of Tier 2 exposure sites online. They simply won't. And so it's not an effective use of all of that energy and human resourcing that can be put into the best and most effective interventions, which relate to household transmission and the transmission of those closest contacts. So I think you'll see that we'll be publishing the highest risk tier sites, as well as letting households know and letting those businesses know what they need to do for those particular higher risk exposures.
So we could be dropping publishing Tier 2 sites, essentially, is what you're saying?
Yeah, I think so.
And at what stage would that likely be?
Well, I think it'll come progressively over coming days.
Sorry, just on that point, we're aware of at least one childcare centre where a teacher's tested positive, hasn't been listed on the exposure website, and families can't get any info from the health department, so they're relying on the childcare centre to provide that contact tracing info, but they're also not aware of it. Is that good enough that we're getting businesses to relay the contact tracing information?
So I'm not aware of that specific case, and I don't know where a delay might have occurred, if it's occurred. But we've always relied on businesses, and we need to rely on businesses to do their role. They've got the specific details of all of those who've been in attendance. They've got the rosters for their staff, and they've got the attendance lists and the kind of registration electronically for each and every child who's coming in. So they are very well placed, and we need to use them and should be using them to supplement the contact tracing that we do. We provide the advice on who needs to be considered a close contact and how long they need to quarantine for. But the work of each and every business has to be hand in glove with our contact tracing teams.
So according to VicGov data relevant up until yesterday, so October 3rd, we now have more mystery cases than we have cases with a known source of acquisition. Are we updating our isolation requirements as a kind of acknowledgement that we have too many cases to handle?
No, so isolation remains a requirement for every positive case. That's a really critical public health intervention. Whether or not they can find out where they got it from, and it's increasingly hard when there are so many positive cases in the community that people might be exposed to. It is still a really critical intervention that those positive cases are isolating at home until they're no longer infectious, and that their close contacts, especially their household and social contacts, are quarantining for the relevant period.
And will you bolster the state's contact tracing team further?
So the metrics that I've spoken of, we're hitting all of those marks. We're contacting positive cases within the 24-hour period, and their close contacts are quarantining in a very timely way. If there is any requirement for additional resourcing, we'll put our hand up for it, but that's not the case at the moment.
Okay, it's great that you're hitting the key metrics. Like, it's great, but we have more mystery cases than we have cases where.
So that's not of concern in and of itself. That is a feature of the fact that there is widespread community transmission, and for an individual, it becomes effectively impossible for them to identify where they might have picked it up. So that's not an issue with contact tracing. That is just a phenomenon that happens when you've got thousands of cases per day.
Are we moving to a point where 14 days isolation will only really apply to those who've tested positive and maybe their immediate household, and that's it?
Look, it'll have to evolve over time, but we need to be consistent for those who might arrive from New South Wales, from other jurisdictions in Australia and internationally, so that the isolation and quarantine requirements are proportionate and consistent. But we'll review that. We're in the process of reviewing that now. We'll continue to review that to make sure that it is proportionate and that we're, again, investing in the highest effectiveness of interventions. There will always be an isolation requirement for positive cases, but with the Delta variant in particular, most cases are going to be positive in that first 7 days. There will be a small percentage who are infectious, become infectious after that 7 days post-exposure, but we're looking at that now.
So 7 days could be the standard, is what you're saying?
I wouldn't jump to that conclusion. It might be 7, it might be 10, but it really does depend on your risk of becoming a positive case. If you're a household member, that is very, very high. If you're an international arrival who's fully vaccinated from a low prevalence country, it might be less than 1 in 100. So we need to look at those comparisons and use the evidence accordingly.
Are there going to be rules across the board for all of these situations, or is it going to be case by case?
No, there'll be rules across the board, but we need to make a consideration for those general categories, for international arrivals, for arrivals from extreme risk zones, red zones, orange zones, etc., as well as for Victorian cases and their close contacts, especially, as I say, the household and social close contacts who are at the highest risk of becoming cases.
Do we know how many secondary close contacts we've got across the state? I think your release yesterday said 33,000 primary close contacts.
I don't know for today, sorry.
On exposure, Mitch's earlier question, Greg Hunt said this morning that he'll be asking the state government to be more transparent about potential exposure sites and where outbreaks are cropping up. I guess, what are your thoughts on that?
We've always been nothing but transparent. So where they occur and there is a need to inform the general population, we do so. There are certain circumstances where a setting is being followed up as a workplace setting. There are no members of the general public who've interacted with that setting or that site, and therefore there's no need for the specific publication of that exposure site. But where it's required, absolutely we'll do so.
I believe he was referring to exposures in the Mornington Peninsula. Are you aware of any lag in the reporting of sites?
No, I'm not.
Is there a shortage of drugs, and bear with me, I haven't heard of these ones, but that treat COVID like Sotrovimab? Should we be buying more? And secondly, what are your thoughts on the oral drug Molnupiravir?
So on Sotrovimab, it's been procured by the Commonwealth. It's been distributed to states and territories, especially New South Wales and Victoria. It is a very effective intervention, especially for those at greater risk of more severe disease. So it's a monoclonal antibody that can be given as an infusion, and for people who are especially at risk in the early phase of their illness and who are at home, it's a very effective intervention to keep them out of hospital, to stop them developing severe illness. To the extent that we require it, we would ask the Commonwealth for more. At the moment, the doses that we have, as I understand, are meeting the needs for our current cases. On the antiviral you mentioned, really good early evidence that this is a pill, an antiviral pill, that can reduce your risk of severe illness by half. And that's a really important intervention. That could be part of a new class of drugs, antiviral drugs, that really change the face in the same way that antiviral drugs for influenza means that people get less severe illness. So absolutely would love to see that go through a TGA assessment and approval process. It's not there yet. We shouldn't forget, antivirals are great if you're developing illness regardless, but getting vaccinated will be 10, 20, 50 times more powerful an intervention in preventing severe illness than any antiviral that's currently available.
Do they work better than ivermectin?
They absolutely work better than ivermectin. Look, when ivermectin was first touted, it had activity in a test tube in vitro. All of us in public health and in the infectious disease world had hopes that ivermectin might be a game changer. And it was therefore a drug that was looked at in various clinical trials as a prevention, as early treatment for milder illness, for more severe illness. None of it panned out as we would have hoped. There are a lot of people who are still very attached to the idea of ivermectin as a panacea, as a cure-all for COVID. Unfortunately, it is just not the case. I understand people's emotional attachment to that and the fact that the idea of ivermectin as saving the world is very appealing, because the reality of a complex, awful, once-in-100-year crisis is a terrible thing to face as a reality. So the idea that there's a simple, cheap, previously approved drug that would work for populations around the world is very appealing. Unfortunately, it's just not true. The reality is the dosage that would have been required for that antiviral activity of ivermectin is many, many-fold above the toxic threshold for human beings. That's the awful truth that we have to all cop. But these other antivirals can and should be seen as positive developments. We'll continue to promote and use anything that the evidence tells us is working.
Just backtrack on one thing. You talk about household transmissions, especially over grand final weekend. Given we've now got daylight saving, the weather is meant to be heating up, not so much this week. Is it time to look for more safer outdoor options for people catching up, so people aren't forced into covert catch-ups in their homes, which is what we've already been seeing?
Yeah, look, I think the opportunities are there. People can go out for exercise, they can go out for recreation as well. We want them to be outdoors, we want them to be wearing masks, we want them to be vaccinated, but those opportunities are there. At the 70% threshold, it's absolutely, the catch cry is go outside, meet outside, dine outside, and have activities outside. So we'll absolutely move in that direction. But at the moment, not before then. I mean, the kind of things that we're flagging at the 70% mark will carry a risk and will lead to some transmission, but we need to do it at a point where we've got the vaccination coverage that allows that not to overwhelm our health system, which, as we've heard in recent days, is already very much under the pump.
Today that some of Melbourne's top horse trainers were allegedly breaching COVID rules by attending a boozy long lunch. What do you say to people breaking rules at this stage?
I don't know that I could say anything more than I've said for the last 20 months about breaking rules. We don't make them up because we want to constrain people's lives in unnecessary ways. We have these rules in place because the evidence tells us that when those rules are not followed, we see greater transmission. And as I've said this morning already, greater transmission is hundreds, potentially thousands of more cases per day. That means deaths down the track. And we've had enough death and dying from COVID globally, close to 5 million cases confirmed globally, hundreds of cases in Victoria and in Australia, and with the potential for many, many more. We just need to minimise that to the fullest extent possible. One of the challenges I know is that it's an invisible virus. You don't see it in someone who looks well, who's well enough to go out with you and have lunch, to meet up with you socially for a grand final party or whatever else. You have to see the risk in every potential interaction because it is there, and that's why we had a spike after the grand final, because people didn't see that transmission might affect them, and then it did.
Are we on track for construction to restart again tomorrow?
Yeah, I think so. Obviously a very hard lesson for construction to be put on pause for that 2-week period, but we've used those 2 weeks to introduce the mandate for vaccination. We've had thousands of construction workers come forward to be vaccinated, which is fantastic, and then a really detailed process of engagement and working through what a good COVID-safe plan looks like, how a well-ventilated or HEPA-filtered crib room works to minimise transmission. And I'm sure for every single worker and employer, reflecting on the literally hundreds of cases that we had in construction prior to this pause, because there wasn't sufficient vaccination, because there weren't appropriate COVID-safe practices across the board, because mask wearing wasn't as strong as it should have been. So I hope all of those are opportunities for reflection, and I think we can absolutely turn it around with all of those measures in place.
Have we been able to work out how much of the industry is vaccinated as yet? That seems to have been a number that's eluded us thus far.
Look, I'm happy to look into it. I haven't asked the question, but there have been tens of thousands of construction workers come forward. There will be a requirement, obviously, for those who are on site to have received their first vaccine.
So do you want someone standing at the front of every building site tomorrow checking each person that comes through that they've got proof of having
Well, there
had a
will
vaccine?
be employer obligations, and there'll be COVID marshals as part of the plan of return to work, and the COVID safe plan has those detailed requirements about oversighting those COVID safe measures that include being vaccinated, that include modifying the crib rooms appropriately and wearing masks.
If there are reports of sites breaching COVID rules, what is going to be the first action? Will it close? Will the whole industry possibly close again?
Look, it's not for me to say. There'll be work safe and inspectors and authorised officers who've got those powers and make those judgments. I don't expect widespread issues that would close the industry again. I certainly hope that's not the case. We've had very significant commitments from the sector to make sure that they're doing everything possible to make sure that they can open safely. So if there are breaches found, it is for those authorised officers to make a judgment about whether it involves letting them know what needs to be in place, or whether a penalty or some other enforcement needs to be undertaken.
Can I just ask a question of Sue?
Please do.
Sue, thanks for your time. How many students do you think across Victoria will take part in this tutor program?
It's a needs basis, and it depends on the amount of tutors that each school has. I could just tell you from what we know at Langwarrin Park Primary, we've got probably 1/3 of our students have been seen to, worked with, and more will happen in term 4. We'll have another round of intake of children. So that's just going from a primary school of, I think we're around 600 to 700 children, 1/3 of those. So if you take that as a medium, you're probably 1/3 of the students or more in Victoria.
Is there a particular age cohort of concern?
I'm only from a primary school sector. It's across the board. It's across the board. You do have to remember, though, that our foundation children had an impacted kindergarten year. Our year ones had an impacted foundation year. So our young ones, definitely. Our older ones, well, the NAPLAN result says they didn't, that we've managed to hit the ball there. But I'd say our young ones, most definitely. Yeah.
The kids you work with, you reckon they'll be excited to get back into the classroom?
Jumping out of their seats, they are, and their parents are so excited to get back on site. They just want to see their friends, they want to reconnect with their teachers, and they want to get back to school life. We've done the best we can in remote, and the children have maintained their excitement, but there's nothing like seeing your teacher and your friends face to face.
Do you have any indication of how many teachers are expected to leave the sector as a result of that, and are there at all concerns of a shortage?
Look, not as yet. You know, we'll cross that bridge once we get to the 18th of October, once we get to the 29th of November. But we did a survey, and we've already had, you know, well over 40,000 respondents, and it's about 98% vaccinated. So I've got great confidence that the vast majority of teachers and staff will get vaccinated in adherence to the requirements. set down by the public health direction. This is a critical intervention, and teachers and staff know it. You know, it's only been in really the last month or so that 12 to 15-year-olds have had access to the vaccine. Under 12s in this country are not yet able to get vaccinated. So this is a critical intervention, and you know, our teachers and staff are there to protect themselves and to protect the kids in the school. There will be a small minority, of course, in every single sector. There'll be a small minority of people who do not want to get vaccinated, and if that's the case in schools, they will not be attending school. Lovely. Thanks, everyone. Have a good day.